This lecture covers the common medications used for heart failure. Diuretics. Loop diuretic. 1. Medication, furosemide, Lasix. 2. Indications, heart failure, hypertension. 3. Action, high ceiling, loop, diuretic that reduces blood volume by increasing sodium and water excretion, decreasing venous pressure, arterial pressure, afterload, pulmonary edema, peripheral edema, and cardiac dilation. 4. Adverse effects, hypokalemia, hypotension, digoxin toxicity. 5. Nursing considerations. Assess serum potassium levels before and after administration, provide potassium supplementation if needed, and monitor for rapid and profound diuresis. Thiazide diuretic. 1. Medication, Hydrochlorothiazide, HCTZ. 2. Indications, hypertension. 3. Action, reduces blood volume and arterial resistance, less effective with low GFR, glomerular filtration rate. 4. Adverse effects, hypokalemia, dehydration, hyperglycemia, hyperuricemia. 5. Nursing considerations. Assess potassium levels prior to administration and hold if potassium level is less than 3.5 mEq/L. Aldosterone antagonist. 1. Medication, spironolactone, aldactone. 2. Indications, hypertension, heart failure. 3. Action, blocks aldosterone receptors, promotes excretion of sodium and chloride, considered potassium sparing. 4. Adverse effects, hyperkalemia. 5. Nursing considerations. Assess potassium levels prior to administration and hold if potassium level is greater than 5.5 mEq/L. Angiotensin system blockers. Angiotensin converting enzyme inhibitor, ACE-I. 1. Medications, enalapril, Vasotec, lisinopril, Zestril, Captopril, Capoten. 2. Indications, hypertension, heart failure, myocardial infarction, nephropathy, prevention of MI, stroke, and death in high CV risk individuals, diabetic retinopathy. 3. Action, prevents the formation of angiotensin II-mediated vasoconstriction and blocks aldosterone-mediated volume expansion, increases levels of bradykinin. 4. Adverse effects, cough, angioedema, mouth, tongue, lips rare, hyperkalemia, renal failure in those with renal artery stenosis, fetal injury. 5. Nursing considerations. Assess blood pressure before and after administration, monitor for first dose, hypotension, take on an empty stomach, assess potassium levels before administration, and reduce dose in kidney disease. Angiotensin receptor blocker. 1. Medications, losartan, Cozar, valsartan, Diovan. 2. Indications, hypertension, heart failure, myocardial infarction, nephropathy, prevention of MI, stroke, and death in high CV risk individuals, diabetic retinopathy. 3. Action, blocks action of angiotensin II at receptor site. 4. Adverse effects, angioedema, mouth, tongue, lips rare, renal failure in those with renal artery stenosis, fetal injury. 5. Nursing considerations. Assess blood pressure before and after administration. Sacubitril, valsartan, Entresto. 1. Indications, chronic, advanced heart failure with ejection fraction, EF, less than 40%. 2. Action, neprilysin inhibitor, increases levels of NPs, blocks harmful effects of ROS, renin-angiotensin-aldosterone system valsartan, and permits beneficial effects of NPs, sacubitril. 3. Adverse effects, hypotension, hyperkalemia, cough, renal impairment. 4. Nursing considerations. May need to reduce the dose in renal and hepatic dysfunction. Do not take during pregnancy. Beta-Adrenergic Blockers. Cardioselective beta blocker. 1. Medication, metoprolol, Toprol XL, atenolol, bisoprolol, esmolol. 2. Indications: dysrhythmias caused by excessive sympathetic activity, prevention of ventricular arrhythmias, reduction of mortality in myocardial infarction and heart failure patients, hypertension. 3. Action: reduces automaticity in the SA node, slows conduction in the AV node, reduces contractility in the atria and ventricles, overall decreases cardiac workload and oxygen consumption. 4. Adverse effects: laryngospasm, fatigue, dizziness, bradycardia, heart failure, dysrhythmias, hypotension. 5. Nursing considerations: assess blood pressure, heart rate, and rhythm before and after administration, notify healthcare provider if heart rate is less than 60 beats per minute, and be cautious with patients with certain cardiac and pulmonary conditions. Cardiac glycoside. 1. Medication: digoxin, Lanoxin. 2. Indications: supraventricular dysrhythmias, e.g., atrial fibrillation, heart failure. 3. Action: vagotonic effect, decreased O2 demand, positive inotropic effect, increased force of contraction, inhibits sodium-potassium pump, increases intracellular calcium. 4. Adverse effects: cardiotoxicity, dysrhythmias, particularly ventricular flutter or fibrillation, bradycardia, fatigue, anorexia, nausea, vomiting, abdominal discomfort, visual disturbances, yellowish hue. 5. Nursing considerations: assess apical heart rate for 1 full minute before administration, hold drug and notify HCP if heart rate is less than 60 beats per minute, assess potassium levels, should be within normal range, monitor digoxin levels, narrow therapeutic range, assess for drug-drug interactions, and consider the use of digoxin immune fab, antidote, for toxic levels greater than 2.0 nanograms per milliliter. 5. Contraindicated in 2nd and 3rd degree heart block, sick sinus syndrome, and certain other conditions. Coronary heart disease ACS, unstable angina, NSTEMI, or STEMI. Antiplatelet therapy: thromboxane A2 inhibitors. 1. Medication: aspirin. 2. Indications: thrombosis prevention in ischemic stroke, TIAs, chronic stable angina, unstable angina, coronary stenting, acute MI, previous and prevention. 3. Action: inhibits synthesis of prostaglandins, suppresses cyclooxygenase, COX, reduces platelet aggregation irreversibly, life of the platelet 7-10 days. 4. Adverse effects: GI bleeding, hemorrhagic stroke. 5. Nursing considerations: dosage may vary, enteric coating may not prevent GI bleeding, monitor for bleeding complications. Adenosine diphosphate receptor antagonists. 1. Medication: Clopidogrel, Plavix. 2. Indications: prophylaxis to reduce MI, stroke, and blood clots in patients with a history of atherosclerosis, blood clots, or placement of stents. 3. Action: irreversibly blocks ADP receptor on platelet surface, inhibits platelet aggregation. 4. Adverse effects: bleeding or hemorrhage, GI distress. 5. Nursing considerations: can be used in combination with 81 mg aspirin therapy for prophylaxis, must be discontinued before surgery and some dental procedures to avoid excessive bleeding, educate patients on bleeding precautions. This covers the information on these medications and their nursing considerations. Always follow clinical protocols and healthcare provider orders when administering medications.